morning. Good morning, all of yours. Myself, Dr.Prabhjeet, working as a Consultant-Pediatrician and Intensivist at Leading Hospital Sector 34, Chandigarh. So we are here again to discuss what is COVID in children. As we are all hearing that अब जो next wave आएगी वो बच्चों को बहुत इफेक्ट करेगी. पेंडेमिक है, बच्चों को अंदर रखो. वैक्सीनेशन बच्चों में करनी है कि नहीं करनी? क्या अब नेक्स्ट वेव में बहुत सारे बच्चे एक साथ बीमार होंगे? ये बहुत सारी queries हैं what we are seeing day in and day out and listening to them. In this video, we'll try to answer a few of them. What is pandemic? With our till date information, pandemic is something which is defined to come in waves. Pandemic का मतलब ही pan माने बहुत सारा all over as it is involved the entire world, entire universe. So जैसे ये involve किया है, इसका fade होने का क्या है? How it will go off? So it will keep coming in waves. The waves could be larger every time, and slowly they end up. So ultimately इसका end कैसे होगा? ये waves आती रहेगी. कब आएगी third wave? कैसे आएगी fourth wave? कितना उसका amount होगा? कितनी उसकी severity होगी? ये हर बार हम anticipate नहीं कर सकते. But then yes, we can have certain ideas about this. So ऐसे ही कुछ waves आती रहेंगी third, fourth, fifth, and somehow ये धीरे धीरे खुद ही कम हो जाएगा. Are children gonna be affected in this third wave and that too in large numbers? This is our next question. Exactly ये बात बताना कि इस बार सारे बच्चे आएंगे और यही कह देना कि अब थर्ड वेव बच्चों को इफेक्ट करेगी वो गलत होगा. But yes, the trend has to be seen. जो फर्स्ट वेव आई जिसमें हमने फर्स्ट इंडिया में जो सिनेरियो देखा, they were all elderly, जो बड़े बुजुर्ग थे, more than 60 was the affected area. Affected age group और उसमें भी जिनमें comorbidities माने hypertension, diabetes या किसी और चीज की बात. The next wave, which is what we are going through, which is coming in large numbers, is the age group of 30 to 40 years, and that even too with no comorbidities. उनको अगर कोई problem नहीं भी है, उनको भी ये wave affect कर रही है. Reason could be because this was the age group which was going out, was still not taking care of all the COVID appropriate behavior. So probably this was the thought process regarding the second wave and that in such huge numbers. But इससे ये inference लेना कि third wave अब बच्चों को affect करेगी, it will be not true. Could be, you should be prepared for that. But then just to create a panic in all the parents sitting at home, yes अब third wave आ रही है तो हम अपने बच्चों को बिल्कुल बंद कर दे बाहर जाना, वो गलत है. बट एक बात यहाँ जानना बहुत जरूरी है कि इफेक्ट तो बच्चों पे फर्स्ट वेव ने भी किया, सेकेंड ने भी किया. इफ वी टॉक अबाउट देयर मेंटल हेल्थ, so it has been affected. The children who were going to school, they were taking their regular classes, who were going out in the evening for entertainment, for playing outside, who were pursuing certain hobbies outside. They are all being restricted at home for the last year and a half now. So mental health तो उनकी इफेक्ट wave 1 में भी, wave 2 में भी, and आगे भी हो रही होगी because this is gonna continue for a little more longer time. एक नया वर्ड भी बहुत आ रहा है जो हम वीडियोस में, इंटरनेट में और बहुत सारी इंफॉर्मेशन में देख रहे हैं, MISC. So let's talk about this now. As we know that this is ये जो सारी गेम है वो इम्यून सिस्टम की है. जैसे ये वायरस इन्फेक्ट करता है, this is our immune system which reacts to this. And बच्चों में it has been seen and हम पहले भी देखते हैं there are many viral disorders which affect them. यहाँ हम एक बहुत ही ट्रिकी बात उठाएंगे कि बच्चों में बहुत commonly on and off खांसी जुकाम होता रहता है या बहुत तरह के वायरल इन्फेक्शंस होते रहते हैं. और ज्यादातर पीडियाट्रिशियंस को ये भी कहते सुना होगा, मैडम 5 दिन की बात है, मम्मा को तसल्ली देने के लिए कि मैडम सिर्फ 5 या 4 या 5 दिन की बात है, बच्चा ठीक हो जाएगा. So this is true. It takes nearly 4 to 5 days. A general course of illness is 4 to 5 days. तो इसमें भी बच्चों में ऐसा ही behavior show किया है. But then there is, I would say, a very small number of children who have a tendency to show a hyper-responsive state. माने COVID नहीं, COVID के post-COVID effects को हम MISC में ज़्यादा देखें. कोविड के इन्फेक्शन में जो भी इम्यून कॉम्प्लेक्सेस का एक्टिवेशन हुआ वो लीड करता है एक साइटोकाइन स्टॉर्म, मतलब जो हमारा अंदर इन्फेक्शियस के अगेंस्ट इम्यून कॉम्प्लेक्सेस बने, उसमें इतना ज्यादा इम्यून कॉम्प्लेक्सेस बनेगा कि वो हमारे अपने ही बॉडी को, सेल्फ को डिस्ट्रॉय करना शुरू करेगा, एंड दैट विल लीड टू MISC जो कहा जा रहा है, मल्टी सिस्टम इंफ्लेमेटरी सिंड्रोम with COVID. So to summarize this, I would say there will be 90% of the children who will be going without any complicated signs and symptoms, and they will be not requiring hospitalization. So next question. So am I ruling out any admissions in ICU by saying 90% will not be effective? I'm not saying. The rest 10% might need ICU or HDUs, but then it has to be detected very early. The one which I'm talking about is MISC, Kawasaki-like illness, has to be detected very early. There are only a few susceptible children who will be having this kind of syndrome presentations. Any kind of fever, which is re-emerging fever, माने कुछ illness हुआ, COVID positive था, चाहे नहीं था, COVID positivity हुई, कोई भी fever हुआ, जो बीच में settle होने के बाद अब फिर से regenerate हुआ, माने फिर से fever आना शुरू, and which is high grade. Rash, any kind of rash which is developing after episode of fever or later on, and that too involving larger area, larger surface area, is of concern. Involving the mucosa, mucosal involvement, which we say आंखों में redness रहना, itching रहना. Second, oral mucosa, माने मुंह के अंदर swelling होना, मुंह के अंदर ulcers हो जाना, या बहुत सारा redness होना, बच्चे का खाना पाना. Or there is sometimes some soreness is also sometimes which is explained in the mouth. Decreased urine output. अगर आपको लग रहा है कि बच्चा यूरिन भी बहुत कम पास कर रहा है और not eating or not having hydration as per the normal, talk to your doctor. So these are the things which you should be very careful about. Always be in touch with your pediatrician. If you have any of these symptoms, even if you have been reported as COVID negative. Because ये symptoms usually एक बीच में lag period के बाद आते हैं, which is usually a week or maybe even up to 14 days. We are not saying कि severe disease होगा नहीं, but the children will be requiring hospitalization or will require ICU will be too small. So we should not be panicked, but yes, we should know what are the danger signs, when to go to hospital and when to talk to your pediatrician. As I am hearing this MISC, मैंने भी बताया कि ये साइक्लोटाइन स्टॉर्म है, क्या ये सब कुछ देखा जा रहा है? ये थर्ड वेव जहाँ कहीं और आई किसी पार्ट ऑफ द वर्ल्ड में, क्या वहाँ ये सब कुछ देखा गया? So I'll answer yes, this is being seen in, and this has been documented even in the by the end of the first wave in UK. They have given a series of data which shows that Kawasaki-like illness have been seen in UK in the first wave as well. So I am just guiding through this video to all my parents around listening to me. Yes, third wave में complications आ सकते हैं, but first में नहीं आई. So ऐसा नहीं है कि third wave सिर्फ बच्चों को affect करे. Third wave किसी को भी affect कर सकते हैं. But yes, बच्चों का effect सिर्फ हम बार-बार सिर्फ हम ICU या severity या illness पे नहीं ले रहे. बच्चों को और भी बहुत तरह से हमें support देना है, as if for their mental, which I have discussed in a previous question. So another question. Vaccine जो हमने adults में लगा दी, and any age group which is more than 18 को हम vaccinate कर चुके हैं. So what about the vaccination? Are we vaccinating the babies or vaccinating the kids or the age group which is younger than 18? So there are guidelines which we will be following regarding the vaccination. But till now we have only guidelines regarding the vaccination of children more than or adults, or not in the children, only for the age group 18 and above. So there are many studies which are going on for the study of this Indian vaccine, especially the age group of 2 years to 18 years. So I hope we'll be getting the results soon. But till then, I just want you to say that COVID appropriate behavior. It says wear a mask, maintain social distancing, and sanitization or washing hands. These three has to be practiced till this waves and waves end off.